Welcome back to Fresh Vitals, your go-to channel for all things health and wellness. Today, we're diving into a crucial topic that affects many of us: medications that can be harmful to your kidneys. Yes, those tiny bean-shaped organs do a lot more than you might think, and protecting them is essential for our overall health. Stay tuned, because some of these might surprise you. First, let's understand why our kidneys are so vital. They filter waste from our blood, balance body fluids, form urine, and help with other essential functions. But as we age, their efficiency can decline, especially if they're exposed to certain medications. So, what medications should we watch out for? Let's get into the details with our list of 7 common medications that could be harming your kidneys. Number 7. Antibiotics. These are life-saving drugs used to fight bacterial infections, but they can also be nephrotoxic, meaning they can damage your kidneys. Ever had a sore throat or a UTI and been prescribed antibiotics? While they're effective against bacteria, overuse or improper use can lead to kidney issues. Be cautious and always ask your doctor if an antibiotic is truly necessary. Antibiotics work by killing bacteria or preventing them from reproducing. Common antibiotics like Cipro, Augmentin, Flagyl, Bactrim, or amoxicillin are often prescribed for conditions like strep throat, pneumonia, urinary tract infections, UTIs, or skin infections. However, they can't treat viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. Improperly prescribed antibiotics can cause side effects like diarrhea and liver and kidney problems. Even when used correctly, some antibiotics such as polymyxins, aminoglycosides, and vancomycin can harm your kidneys. They can damage kidney cell membranes, accumulate in kidney cells causing cell death, and harm kidney tubules. For antibiotics to be effective and safe for your kidney health, it's important to use them correctly. Nearly 1/3 of antibiotics prescribed in the United States aren't appropriate for the conditions being treated, according to a report from the CDC and a study published in the Journal of the American Medical Association. Before asking for an antibiotic or if your doctor prescribes one, ask, "Is this necessary?" and follow the dosage exactly as instructed. Never save antibiotics for future use or give them to someone else, as prescriptions are tailored to individual health needs. Number 6. Nonsteroidal anti-inflammatory drugs, or NSAIDs. Common names include ibuprofen, aspirin, and naproxen. These drugs are great for pain relief, but can cause significant kidney damage when used excessively. NSAIDs work by blocking an enzyme called cyclooxygenase, COX, that helps produce pain-causing substances. However, COX also protects your kidneys during stress and helps regulate sodium and water excretion. Blocking COX can narrow kidney blood vessels, reducing blood flow, leading to fluid retention, high blood pressure, and even mild temporary kidney impairment. NSAIDs can cause acute kidney injury, AKI, especially in older people and when taken in high doses or over extended periods. This injury appears in 2 main ways: changes in blood flow and inflammation. Blocking COX can lead to fluid retention and high blood pressure, potentially causing acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. Even though NSAIDs are anti-inflammatory drugs, prolonged use can trigger inflammation in kidney tubules, affecting 1% to 5% of daily users worldwide. A study published in the Journal of the American Society of Nephrology found that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. Number 5. Diuretics. Often prescribed for conditions like heart failure and hypertension, diuretics help your body expel excess salt and water. However, they can also cause dehydration, which is a major risk factor for kidney damage. While diuretics are beneficial overall, excessive use or high doses can lead to dehydration, increasing the risk of kidney damage. A study found that patients using diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. Diuretics work by increasing urine output and changing the levels of electrolytes in it. Excessive use can lead to dehydration, which is a risk factor for kidney damage. Patients using diuretics should stay hydrated and regularly check their electrolytes and kidney function. Always consult your doctor before starting new medications with diuretics, especially if you have chronic kidney disease. Stay hydrated and regularly monitor your kidney function to ensure safe use. Number 4. Proton pump inhibitors, or PPIs. These are commonly used to treat acid reflux and GERD by reducing stomach acid. Popular names include omeprazole and esomeprazole. While PPIs are effective for short-term use, long-term use can lead to kidney issues like acute interstitial nephritis, AIN. This condition is characterized by inflammation in the spaces between the kidney tubules and can often go unnoticed. PPIs have been linked with acute interstitial nephritis, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Long-term use can lead to lower kidney function and acute sudden kidney injury, which can progress to chronic kidney disease. An often overlooked side effect of long-term PPI use is low magnesium levels in the blood, or hypomagnesemia, which is linked to chronic kidney disease. Regular checkups to monitor kidney function and magnesium levels are essential for those taking PPIs. Number 3. ACE inhibitors. These are used to lower blood pressure and protect the heart and kidneys, especially in people with chronic kidney disease. Common ACE inhibitors include lisinopril and enalapril. ACE inhibitors work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By stopping this enzyme, ACE inhibitors help relax blood vessels, thereby lowering blood pressure and reducing stress on the heart. Normally, ACE inhibitors improve blood flow to the kidneys, easing their workload. However, when mixed with NSAIDs and diuretics, the risk of acute kidney injury increases. Also, when you don't drink enough water, taking ACE inhibitors can put you at more risk of acute kidney injury, or AKI. If you're concerned about your risk of AKI when taking these drugs, it's best to talk to your doctor about ways to lower it. Regularly monitoring your kidney function and adjusting dosages as necessary can help mitigate the risks. Number 2. Antiviral drugs. Used to treat serious infections like HIV, hepatitis, and recently, COVID-19. These drugs can sometimes harm the kidneys through direct toxicity or crystal buildup. For example, remdesivir, a drug used for COVID-19, contains a substance that can build up in people with kidney issues, causing toxicity. Other antivirals like cidofovir and tenofovir can cause direct cell death in kidney tubules. Antiviral drugs can cause acute kidney injury by reducing blood flow or increasing toxins. Acyclovir, indinavir, and foscarnet can cause crystal buildup in the kidneys, blocking kidney tubules. Proper management and customized treatments are necessary, especially for people with existing kidney problems. If you're on antiviral medications, follow your doctor's instructions carefully and ensure regular kidney function tests. Never skip doses or inconsistently take them, as this can lead to antiviral resistance, making the medication less effective. Number 1. Lithium. This medication is used for mood stabilization, particularly in bipolar disorder. While it's effective, long-term use can lead to serious kidney issues. Lithium can cause a type of diabetes related to kidney damage called nephrogenic diabetes insipidus. This condition makes your kidneys unable to respond properly to a hormone that controls fluid balance, leading to excessive thirst and frequent urination. Lithium use can also lead to end-stage renal disease, ESRD, in rare cases. Symptoms of kidney trouble from lithium include excessive urine output, frequent nighttime urination, and signs of dehydration like low blood pressure and a fast heartbeat. If you're taking lithium, maintain a regular diet with enough salt and fluids, and get yearly blood tests to check creatinine levels. Inform your doctor of any kidney, heart, thyroid, or other health issues before starting lithium. So, what should you do if you're taking any of these medications? Here are some extra tips to help you use them cautiously. First, always consult your doctor about any potential kidney risks associated with your medications. Second, ensure you're staying well hydrated to help your kidneys function optimally. Third, regularly monitor your kidney function through blood tests. And lastly, maintain a healthy lifestyle with a balanced diet and regular exercise to minimize the need for these medications. Remember, medications are essential for treating many conditions, but some can pose significant risks to your kidney health. By being informed and cautious, you can protect your kidneys while managing other health issues. If you found this video helpful, give it a thumbs up, and don't forget to subscribe to Fresh Vitals. Hit the bell icon to stay updated with our latest health tips and guides.